About to show you a cool tradition that happens every night in Vancouver at 7 o'clock. It's about 7 o'clock right now. There it is. 7 o'clock each night in all these towers, all over the whole city. Everyone comes out.
Well, as we got into May, the pot banging at 7 p.m. stopped. I mean, I think it was May, maybe June. Nobody really knows. I mean, think about it. This is in April, and it had been going on about a month then.
Shut up! Shut the fuck up!
The total hospitalized cases of COVID were 120 in the whole province. It started in March, right?
Look what they did in Italy with the singing, right?
And hospitalized cases in the entire province were 17. Just seems a little, unnecessary. I mean, I still get it and everything, but, where's Larry David when you need him?
Oh, my social distancing.
The cases started to diminish in May, but Bonnie Henry and Adrian Dix were there on the news to explain all the numbers and every little reminder about social distancing, no gatherings, flattening the curve, washing hands, face and surfaces, isolation, following the science, what are the symptoms, etc., every day. It was like some New World Order cult program you had to watch every day to become indoctrinated.
This procedure in the opposite nostril using the same swab.
So I don't think I personally ever got a swab test until the do-it-yourself ones came out much later. But as I'm seeing in the videos here, you had to drive in through some appointments to get tests before the lineups of people standing. I think, anyway. This one in Montreal, people are on foot, so I'm not totally sure, but obviously there were people in these lineups in 2020 eventually, and that became the norm for a good year about.
I started out by calling the nurse's line. I had my personal health number and the number of the individual who was presenting symptoms with me. I was given a full assessment that confirmed that this individual met the requirements for testing. I was then given a second phone number to call to schedule an appointment for testing. A personal health number was required. Our appointment was scheduled for 24 hours after this phone call. We went for the swab. We were sent to a drive-through testing location. I was pleasantly surprised that because it is appointment-based, there are not very many people there. We were actually the only car there when we arrived. We were welcomed by a security guard who was standing underneath a tented area. He ushered us in with hand motions and told us when to stop once we were under the covered tent area. The nurses were to the side and they approached our car once I had shut the car off. I would say that from start to finish, the swab going in and coming out took about 2 to 3 seconds.
COVID's in my teeth, yeah. I got COVID in my teeth. And I'm gonna fucking bite you. I'm gonna bite you. If you don't believe in me, I'm giving you COVID-19.
Right out of the gate, the BC Centre for Disease Control developed an independent test for COVID-19, making sure that we could more rapidly assess risk, rapidly assess outbreak, because we didn't have to send our samples to a national lab. And since January, we have tested 2,803 samples involving 2,008 individuals. By the end of next week, we will have 4 additional labs able to test for COVID-19, as well as in the coming month, additional machines so we can continue to increase the testing available to British Columbians. You will know that until recently, British Columbia had tested more samples than the entire United States.
Not everyone needs to be tested if they feel symptoms, explains Dr. Bonnie Henry. While the basic advice continues to be keep things clean, the province is now working on getting testing centers up and running. But testing has been challenging because the number of patients has been rising quickly. Although we have not yet had a shortage of the test swabs here in BC, the province has been proactively preparing as demand continues to increase and supply declines.
BC CDC has been looking at the use of a different swab that we have quite commonly that we use for testing for, I don't know if I should, testing for sexually transmitted infections.
Here back in March, we see the swabs used to test for COVID-19 running critically low. Swab tests for COVID-19 were implemented in early 2020 with the FDA issuing the first emergency use authorization for a CDC-developed diagnostic kit on February 4, 2020. While initial testing was severely restricted to specific cases, widespread testing began to ramp up in early March 2020 with the involvement of commercial labs like Quest and LabCorp. Key 2020 testing milestones. February 5th, 2020, CDC began shipping kits to select laboratories. February 29th, the FDA allowed academic and commercial labs to begin testing before formal authorization. March 13th, major drive-through testing sites were launched in the US to address rising case numbers. March 27th, FDA approved Abbott Laboratories molecular point-of-care tests for rapid results. April, May, testing expanded, though shortages of swabs in regions continued throughout the spring. Along with measures specific to the retail sectors, province says retailers need to consider core principles such as frequent cleaning of high-touch areas and making accommodations for higher risk groups such as seniors and those with underlying medical conditions. Restrictions on large gatherings of more than 50 people do not apply to large box stores, grocery stores, or malls. Interesting. When there's money to be made, then they don't restrict you. I remember the thing about the frequent cleaning. They would literally go on the speaker in the store like Walmart and say, hey, it's time to wash your hands. Literally, like.
Hello.
Could you reach me a towel?
I really can't do that. I'm sorry.
Install physical plexiglass barriers between checkouts. Restrictions on large gatherings in BC were officially mandated on March 16th. This initial order banned gatherings of over 50 people. 6-foot distancing in BC retail checkout lines. Many stores implementing the floor tape markers. They had like spots where you where they directed you how to go into certain aisles. I think like there was like one-way traffic allowed in them at one point, I think. So the sanitizing high-touch areas, crowd control to keep people 2 meters apart, that started March 29th. Alternate measures. Stores began opening only every other checkout lane and installing plexiglass barriers as early as March 21st.
Thank you and good afternoon. So for today, May the 5th, we have had only 8 new cases test positive today, bringing our total number of cases in British Columbia to 2,232. That includes 849 people in Vancouver Coastal Health, 1,031 in Fraser Health region, 124 people on Vancouver Island region, 177 people in Interior Health region, and 51 people in Northern Health. We're now at 134 cases. We continue to be at 134 at the Mission Federal Correctional Facility, including 121 inmates and 13 staff. The orders and restrictions that we have put in place are still in place. So please don't start planning your play dates and expanding your bubble too soon. We need to hold the line right now. You need to continue to clean your hands and cover your mouth when you cough and avoid touching your face. With no exceptions, we need to be very vigilant about staying home and staying away from others if we have any sort of illness. And this is going to be incredibly important, not only for the coming weeks and months, but as we go into the respiratory season next fall. We need to maintain our physical distancing when we're outside our home, when we're in the community. That's a way that helps us protect each other. Few faces and big spaces is what we need to think about. No handshaking or hugging for right now, for the people that are outside your household or your pandemic bubble. Keep your number of contacts low, in particular if you have people in your household, in your family, who are more vulnerable to having more severe illness from this disease. And outside is always preferred over inside. We need to make the necessary contact that we have when we're close to each other safer by putting in place some of those administrative or engineering controls that can help us have safe close contact. That includes those plexiglass barriers or reducing the numbers of people in a shop, for instance. We need to continue with our increased cleaning of those high-touch areas, both at home and at work and in the community when we're out and about.
Okay, people do need to grocery shop, obviously. Try and limit the number of times you go to the grocery store. That'll just allow you to keep better social distance. And keep in mind, this is not a foodborne illness. You're not going to get it from eating the food. And it's very unlikely you're going to get it from packages. But we do know the virus can live on surfaces. For example, steel and plastic for up to 3 days. I've used a little glitter here for my kids to show you what the virus might be like. We know they can live on cardboard, for example, up to 24 hours. So what I've done here is I've created a dirty area and a clean area. This was a suggestion from Dr. Van Wingen up in Michigan. Here's my dirty area. I'm just gonna clean all the virus off here. Don't need to do too much. It's a pretty sensitive virus. For cardboard, it's typically gonna be closer to 24 hours.
And we need to consider the use of non-medical masks for those short periods of time when we may not be able to keep our physical distancing. In addition, we need to be very cognizant about reducing our non-essential travel.
Sectors of society that have been opened up in other jurisdictions, from garden shops to construction, to resource sectors, all of these have never been closed in British Columbia. So this means that we've managed by following the science here.
Follow the science. You're probably still sick of hearing that one. That became a viral rallying cry in early March 2020. Justify rapidly shifting COVID-19 policies like school closures, mask mandates, and lockdowns. It was adopted as a mantra to present decisions as evidence-based rather than political, particularly to counter early pandemic skepticism. The phrase served as a blame avoidance strategy, allowing politicians to defer difficult, high-stakes decisions to chief medical officers,
by ensuring that those who continue to work do so safely, to model the kind of behavior we're going to continue to model in the days and months to come as we prepare for this summer, which we hope and we believe will be a summer of renewal. And I want to just underscore in that respect the role the health system plays in that. Physical distancing, as you know, saves lives.
I think the challenge with testing is we have the capacity that we believe we need right now, and we've opened it up, as you're aware, for anybody with symptoms in our community to be able to be tested for COVID-19 if it's appropriate. And that will continue. We are going to ramp up as we head into the fall, when we know that we'll have more respiratory illness, and that we'll be wanting to test for both influenza and COVID at the same time. And they're very similar use of the swabs and the machines, for example.
Thank you very much for taking my question. Alberta has now rolled out a contact tracing app, while Dartford in Ontario wants a national app. Now that BC is going to be relaxing restrictions, contact tracing will be even more important, but also harder to do as people expand where they're going. So I'm just wondering if you think that contact tracing apps are useful, and I'm just wondering if you are developing one here in BC or waiting on the federal government.
Yeah, so obviously there's everybody and their dog has an app out right now. What we are trying to do and what we have been doing, and I've been working with my colleagues across the country, is to find ones that might help us with the issues that we have in our contact tracing. And we have been trialing some apps to assist in that, particularly to assist in when we identify a case and we identify contacts, being able to connect with them and use some of the information to help find out where they have been and who they've been in contact with.
Comments. Your comments are so good.
Contact tracing apps? Yeah, that's going to be a no for me, thanks. Hopefully someone runs honest numbers on places with social distancing policies and ones without. Given the math model for social distancing was already proven completely inaccurate and was never peer-reviewed. Henry Dix recklessly endangered BC lives by presiding over the worst testing performance in Canada. Lying sack of shit. Read the book Control Theory. It will help understanding the psychology behind our lockdown. BC government reveals details Wednesday about its plan to ease pandemic restrictions to reopen the economy, following a steady decline of new COVID-19 cases in BC. Plan includes guidance for retail stores to reopen around mid-May under enhanced protocols. Most stores in BC were not legally required to close, but many chose to do so voluntarily. Interesting.
Including a serology blood testing study to determine immunity in British Columbia, and I know that will appeal to a lot of people, so I encourage you to look at this survey. The other study that we're looking at is getting your advice and support about how we could use technology to coordinate information sharing and contact tracing going forward.
Inside the testing area at the BC Centre for Disease Control's Central Laboratory in Vancouver, recirculated air carries a metallic smell. Medical lab technologists work quietly against the whir of machinery, holding samples between their fingers that could inform the province's pandemic response. The lab is one of several sites across BC and Canada racing to evaluate serology tests in an effort to better understand whether people who have been infected with COVID-19 are immune to the virus once they recover. That is the $1 million question, said Dr. Mohammed Murshid. Serology tests or antibody tests look for the presence of antibodies to a virus in a patient's blood. Antibodies are a sign that the patient's immune system has reacted to an infection, indicating they may have once been infected with the coronavirus and are now possibly immune. On Tuesday, Health Canada said it authorized the first COVID-19 serological test for use in the country. Part of the BC CDC's work is evaluating the effectiveness of serology tests. That could be like a song. BC CDC! The lab in Vancouver is still processing between 700 and 800 tests for active COVID-19 cases every day, down from 2,000 at the peak of BC's pandemic. That remains a challenge as we try to relax physical distancing. What we're trying to do is make sure there's sufficient testing to allow the decisions of how to respond to be made in real time, said Dr. Mel Cradgen, medical director of the BC Public Laboratory. We're looking to be very nimble, very responsive. Look at the information that we collect on a daily basis and use that and share that with our provincial medical health officers. The lab is also evaluating rapid blood tests for the virus, some of which can return results in 15 minutes.